went to med school with my sign. I wanted to serve. I was compassionate, idealistic. I never really talked about money. I never talked about competing with my partners. I never talked about being dissatisfied with my work. Getting into the grind of practice, it very much is real. It's stressful being in medical practice. There is real pressures. People do get sick. There are complications. There are, ancillary revenue streams that put pressure on you. For instance, if you buy a surgery center or build one, now those people work for you. Anyway, that all mounts, and you get to a point of burnout, and you get to a point of, is this really the purpose I was doing? Did I really get into this to fight all these different battles? And then I started to do rural care. And then it was very clear to me that we were basically taking very, there's no simple surgeries, but very straightforward surgical procedures out of these towns at great peril to the hospital. Because if the hospitals don't survive, neither do the patients. If a hospital closes, the mortality in that community goes up 6 to 10%. That's huge. That means that, instead of one person dying, 1.6 people die. That compounds over time. So for me, I could only have a personal impact of one surgeon doing these programs. By implementing programs across multiple states and multiple areas, there is no limit. There is no ability for that need to serve and have compassionate care that's quality and profitable for everybody. There's no cap to that now. It's hard not to be passionate about that. As a practicing physician, I was not saving lives on a daily basis. This company saves lives on a daily basis because of the services that it provides. When we looked at the way to develop the program, it really almost became more of a discussion for the Chamber of Commerce than the hospital. It's an economic thing. This is a very quick way to invigorate the economy of the whole entire community and raise the level of care, indirectly making people healthier. Healthy town has a healthy hospital, or vice versa. And then even a step further was the fact that by keeping these resources and that revenue in town, the hospital would be able to save lives. We were really founded in 2010, although the concepts were put into place in 2009. The first contract, like I mentioned, was in Alliance, Nebraska, and it was one orthopedic surgeon, me, every other week. Now, I would say the core business, we're in 50 contracts in roughly 10 or 12 states, and that doesn't include the peripheral businesses that we've associated with, either through acquisitions or growing new service lines, and where we probably touch close to 100 hospitals in 17 states on a monthly basis. The scope of services goes from all the facets of surgical care that can be done in a rural market: orthopedics, spine surgery, urology, ENT. We don't really do well financially unless we can show you that you have a need. So we try to define a community need, a hospital that's supportive, the doctors or the providers or the support for that, and then is it good for us in that order. We would never offer a contract in some place that we didn't think we could make an impact. Once that impact happens, the health of the community is going to rise in almost a no-risk way. For instance, if you were a small hospital and you had orthopedic surgeons coming once a week, taking most of the care out of your town, and you hired us, well, we're not going to stay unless we successfully keep those patients in town, because we won't get paid. Neither will the doctors. And there's no real risk to the hospital, other than maybe a little capital to buy equipment for the OR or whatnot, but the risk far is outweighed by the benefit. So there's really just no reason not to partner, because it's collaborative.